Hello, my name is Dr. Angela Lamarca. I am one of the medical oncologists from the Christie NHS Foundation Trust, and I am going to present the results of the natural history of patients with advanced cholangiocarcinoma and FGFR2 fusion gene fusions and rearrangements work that they have done together with another very relevant medical oncologist in the field. As we know, the cholangiocarcinoma is a rare and heterogeneous malignancy with poor prognosis, and it's true that the FGFR fusions are a subgroup of patients, around 10 to 16% of all the patients with intrahepatic cholangiocarcinoma with specific clinical characteristics. The more we are performing molecular profiling, the more we are learning about these specific characteristics, and the more we are also testing the FGFR inhibitors in the setting of clinical trials. And we now know that the use of FGFR inhibitors for patients with cholangiocarcinoma and an FGFR2 fusion is of clinical benefit. This study is a retrospective assessment of an observational study looking into the natural history of patients with advanced cholangiocarcinoma, specifically focused on patients with the FGFR2 fusions. The data source is data collected from Flatiron Health and Foundation Medicine, as you can see in this slide. The objectives of the study was the primary objective to evaluate the real-world overall survival for patients with advanced cholangiocarcinoma in two different groups of patients. The first group is the population of patients with an FGFR2 fusion-positive cholangiocarcinoma, and the second group is patients with an FGFR2 wild-type cholangiocarcinoma. The aim was to assess whether the presence of an FGFR2 fusion was actually having an impact on patients' overall survival. Other objectives include to evaluate the influence of the FGFR status on real-world overall survival after adjusting to other prognostic factors in a multivariable survival model. And finally, subgroup analysis looking into the real-world overall survival in Group 1, the FGFR2 fusion-positive, and Group 2, the FGFR wild-type, first in patients with intrahepatic cholangiocarcinoma, measuring the overall survival from date of diagnosis, and second, measuring overall survival for the start of second-line treatment. In this slide, you see specific details on the inclusion criteria. As you can see, we were looking into data from patients with advanced cholangiocarcinoma, where there was evidence of some NGS-based Foundation CDX or Foundation 1 assays for molecular profiling. The statistical analysis was including overall survival assessed by Kaplan-Meier, and as I mentioned previously, there was also a Cox regression multivariable, including other prognostic factors to assess whether the presence of FGFR2 fusion was an independent prognostic factor or not. We had data of a total of 572 patients diagnosed with cholangiocarcinoma between January 2011 and May 2019. All of these patients had undergone a molecular profiling. Out of the patients, we identified 437 patients, 71 of them with FGFR2 fusion and 366 wild type. These are the eligible patients included in the analysis that I am going to show you later. These are the demographic. You can see in the first row patients with the FGFR2 fusion positive cholangiocarcinoma, total of 75 patients, and the second group patients with the wild type FGFR2 cholangiocarcinoma, total of 486 patients. In total, 571 patients including. Out of these, 50 patients were treated in the second-line setting. These are further details on the treatment management utilized for these patients. As you can see, 4% of the patients with an FGFR2 fusion-positive cholangiocarcinoma were actually managed with some form of an FGFR inhibitor at some point, and 40% of them were treated within a clinical study drug. These are other baseline characteristics, including the center where the patients were treated, and also performance status and the stage at diagnosis. This is the primary analysis of the primary objective, the median overall survival by the presence or absence of the FGFR2 fusion. As you can see, there is a trend showing that there is a longer overall survival for patients with an FGFR2 fusion. This is 12.1 months compared to 7.1 months for patients with the FGFR2 wild-type cholangiocarcinoma. Unfortunately, as you can see, the p-value does not reach a statistical significance. So even though there is a trend towards longer overall survival, this was not statistically significant. In the second-line setting, the median overall survival was 8.5 months for those 50 patients treated in the second line, as we mentioned previously. As I have explained in the method section, there was also a multivariate Cox regression assessing whether the presence of the FGFR2 fusion was an independent prognostic factor. Here you see other factors that were prognostic and included in this multivariable analysis, including the sex, the race, the performance status, and other important variables, for example, the anatomic origin. And as you can see at the beginning of the table, the FGFR2 status did not actually impact on overall survival in this multivariable analysis. There are some limitations of this study, and it's quite challenging. Of course, the main one is that the fact that because these are retrospective data, it's quite challenging to actually make a good interpretation of the results. We also know that there is some form of selection bias because we were only recruiting patients where there was some form of molecular profiling performed. There was also significant missing data. For example, performance status was missing for a significant proportion of patients. To conclude, the analysis of this real-world data did not show a statistically significant difference in the real-world overall survival of patients with FGFR2 fusion or rearrangement compared to the wild-type population. However, there was a longer real-world overall survival when we are speaking about the number, about the median of the overall survival, even though these differences were not statistically significant. The FGFR2 status was not a significant predictor of overall survival when adjusted to other covariates, as I showed you in the multivariate analysis. The subgroup analysis performed in patients with intrahepatic cholangiocarcinoma did not show a statistically significant difference between the FGFR2 fusion rearrangement versus the wild type. And finally, in the subgroup analysis performed in patients with FGFR2 fusion or rearrangement receiving second-line treatment, median real-world overall survival from the start on second-line treatment was 8.5 months, with a 95% confidence interval between 4.1 and 12.4 months. I would like to thank everyone involved in putting this data together, analyzing the data, and also with the support of putting all these slides together. And I would like to thank you all very much for your attention. These are some references that could be of interest for further looking into our results. Thank you.